Well, good evening and thank you for attending Let's Talk Health. My name is Peter Ohm and I'm the Chief Planner for the City of Edmonton. I've been to these before and I'm looking forward to another great night of discussion. And tonight we have a number of special guests for our Let's Talk Health, including Councillor Scott McKeen. Zanette Frost, who's going to be tonight's moderator, and then our panelists, Anne, Yvonne, Candace, as well as Dr. Larry Frank, who is visiting from Vancouver. It's going to be here for a couple of days, helping out the City of Edmonton think a little bit more deeply about Let's Talk Health. If I missed any other councillors besides Scott McKeen, if you could just show your hands. Scott, I think you're here solo tonight. Okay. So we'd like to start the evening by acknowledging the traditional land upon which we are gathered today, which is also the territory of the Treaty 6 First Nations and the Métis Nations of Alberta Zone 4. We'd also like to acknowledge and to thank the diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, and who make their home here today, such as the Cree, Dene, Satu, Nakota Sioux, Blackfoot, as well as the Métis and the Inuit. This is, as I mentioned before, the 8th event of the Great Ideas, Great City Speaker Series, and past topics included Let's Talk Food, Let's Talk Heritage, Let's Talk Infill, Let's Talk Parks, and Growth, Design, and Transit. Transit was our first, I think, in the fall of 2015. So it's become a bit of a habit and really quite an interesting evening with great discussion. Our goal in this series really is to support those new conversations about city building for and with Edmontonians. And through the series, we've highlighted a number of projects that we as the City of Edmonton with Council are working on in the hopes of making the city a better place to live, etc., and to be more healthy, in fact. So Let's Talk Health will focus on relationships between the built environment, other social determinants of health, and their influences on us, the people that live in the city. It wasn't that long ago that we came to recognize that health outcomes are connected to how and where people live, and this recognition then provided the imperative to plan and build better cities. So just for example, at the beginning of the last century in Canada, the coordinated efforts of early public health professionals and urban planners led to improvements that created the basic infrastructure and services that make up our modern cities today. And I think many of us take those things for granted, such as potable and safe drinking water, waste collection, and sewer system, and of course, fire protection. Today, our challenges and opportunities may be a little bit different, but the objectives and interests of the planning and health professionals and citizens remain aligned. I think we all have strong interests together. The importance of health is visible in our highest policy documents, which we call the Ways at the City of Edmonton. And for example, in the Way We Grow, which is our municipal development plan, the Way We Move, which is our transportation master plan, we know that, and this is a quote, the design of neighborhoods and access to a range of transportation opportunities have a direct impact on public health. The way our cities grow and the way people move are determinants of an individual health and well-being. So whether it's our transit strategy, community traffic management program, the downtown bike grid, transit-oriented development, residential infill, the green network strategy, or just better urban design, Council and administration are striving really to improve the relationship between the city's built form and the people that live in it, and of course then their health and the outcomes that can be benefited from there. Tonight we're going to highlight the work of our colleagues in citizen services who are leading the Hello, How Are You campaign. This campaign includes the Council initiatives on urban isolation and mental health, as well as the Council initiative on seniors. Increasing social connectivity and a sense of belonging in our communities creates a healthier and friendlier Edmonton. With Mental Health Week starting next week, this is a reminder for planners, public health professionals, and city staff in general of the work ahead of us to support all Edmontonians. If you didn't get a chance before we started, following the talk, you can visit Chelsea at the tables. There's more information about the Hello, How Are You campaign, and then also Tracy from the Canadian Mental Health Association with additional information about Mental Health Week. An ongoing campaign of these initiatives, a champion, I should say, an ongoing champion of these initiatives is our Councillor Scott McKeen. So we're fortunate to have him here tonight, as he has been for a number of past events. I'd like to take this opportunity now to have Scott come forward and say a few words.
Thank you. Thanks, Peter. Thanks to everyone for coming out tonight. It was great of you to sign up for an event that will last till midnight, and you'll have to miss the hockey game. That was very good of you. They didn't tell you that? I'm a little off. I'm a little punchy because it's been a long week. So if I drop an F-bomb in the middle of this, it could happen. Just ignore it, please. I am really pleased to be here on behalf of Mayor Don Iveson and the rest of City Council to be here for this Let's Talk installment. Tonight's panelists will help us learn about health equity and how the built environment and social factors impact our health. As a City Councillor, I have the honor of leading the city's initiative on urban isolation and mental health, and I do that I will tell you, as a survivor of an anxiety disorder in my teen years and a clinical depression through my 20s and early 30s. And so when I got on council, I went to the mayor and asked him if there was a council initiative on mental health, and he said no. I said, would you consider that? And he said, absolutely. And the social isolation part, we added in too, because we know that social isolation or urban isolation is epidemic in modern cities. Probably the design of cities, as Peter mentioned earlier, is part of it. Technology is part of it. The way people travel across country to get jobs, that's part of it. But we have an isolated, we have too many people living isolated lives, and we know that has huge impact on their health. So the initiative that I'm honored to lead aims to improve mental health and well-being by connecting residents within their communities, and perhaps as importantly, to get people talking about the fact that they feel somewhat disconnected or isolated. And that's a tough thing to admit because, you know, who wants to admit that they feel lonely living in a city of 900,000 plus people? But it's very common. It's so common that, that it is a major, major health issue for cities like Edmonton. So thus, the Hello, How Are You campaign, which embraces the simple idea that a quick hello can go a long way towards creating a sense of belonging. Try it walking down Jasper Avenue sometime. Just a stranger walk toward you, just say hello, and watch the weird look you get from them. It's fun. But you know, I think one of the simplest strategies for mental health is to, when you're walking around the city, is to lift your head up, look around you, be where you are, and add that thing, that hello to people. There's something about eyes up, not in your head, not in your worries and woes, and being in the moment that can make a huge difference in the way the day feels to you. Locally and globally, we live closer to one another than ever before. With technology, we're more connected. Yet in many ways, we have never been lonelier or more isolated. 25% of all Canadians describe themselves as lonely. Loneliness has been linked to depression, anxiety, health problems, and even suicide. And it's no secret that mental illness, isolation, and poverty often go hand in hand, each fueling the other. We have to ask ourselves, what good does it do to treat people's illnesses if we send them back into the conditions that made them sick? Knowing our neighbors is an important part of our ability to respond to stressful experiences. And those who feel connected to a supportive community are far less likely to experience stress, depression, loneliness, and isolation. So we need to do more to connect people to each other and to services that can help them to build a more engaged community. So that's what we're doing with the city's Hello, How Are You campaign and through conversations like this. So I really do appreciate you all being here tonight on an Oilers game night. I'd like to thank the panelists for sharing their perspectives, The knowledge from today's event will open us up to new ways of thinking about health and how we can help promote and address health equity in Edmonton. Thank you very much.
Thank you, Scott, and he was well behaved. Even after third day of council, we have another half a day tomorrow. So now I'm going to ask the panelists and our moderator to make their way to the stage. And once they're settled on stage, I'll read a brief bio for each member, and then I'll turn it over to Zanette. So if I wonder if you could come up, please. So as I introduce each of the panelists, if you could just perhaps give a wave and people can recognize you. Ann Harvey. Ann coordinates Abundant Community Edmonton, a grassroots neighborhood engagement and organizing framework that encourages and enables neighborliness and a culture of connection. Ann also plays a variety of roles with the City of Edmonton in the Citizen Services Department. She collaborates with neighborhood groups to develop organic processes and comprehensive resources that further enable and enhance their community building efforts. Ann has a degree in recreation, sport, tourism from the University of Alberta, a teaching certificate in English as an additional language, and is professionally trained in facilitation and project management. She's enrolled in the University of Victoria's Master of Community Development program, and Ann's work with the City and the University of Victoria is integrated and in collaboration with the asset-based community development community in Canada, the US, and Great Britain. Welcome, Ann. Dr. Candace Nykiforuk. Dr. Nykiforuk is an associate professor in the School of Public Health at the University of Alberta and an applied public health chair in public policy and community environments. She's a health geographer and a health promotion researcher with a strong interest in the role of the public and social environments on health equity and well-being. She also has extensive experience in the development and evaluation of public health policies. And in 2015, she was honored to receive both the University of Alberta's Martha Cook Research Prize as well as the Community Connection Scholar Award for her outstanding research and engaged scholarship. Candace is an applied researcher, which is typically conducted in partnership with practitioners and decision makers in the communities and other settings that she is working with. Candace is also a Let's Talk alumnus of having participated in June 2016 for the Let's Talk portion, Let's Talk Parks, which course connects to our draft Green Network strategy and where wellness is one of the key themes of the Green Network strategy. We're going to be going to council next month to deliver that. Dr. Yvonne Chiu. Dr. Chiu is one of the founding members of the Multicultural Health Brokers Co-op in Edmonton. The co-op is owned and operated by workers of immigrant and refugee backgrounds and address the health inequities and social exclusion experienced by individuals and families. She has spent the past 2 decades exploring a variety of participatory processes to engage immigrants and refugees in making visible their struggles, aspiration, and cultural capital, and articulating the cultural brokering practice as an essential tool for developing social capital and social change. Prior to this, Yvonne has worked as a settlement counselor in Edmonton's Chinatown, a social development officer at the Alberta Multicultural Commission, and a health promotion practitioner. She's a lifelong foot soldier and learner of community building towards peace and solidarity. Welcome, Yvonne. Dr. Larry Frank. Dr. Frank is the Bombardier Chairholder and Professor in Sustainable Transport and the Director of the Health and Community Design Lab at the University of British Columbia. He specializes in the interaction between land use, travel behavior, air quality, and health. He's been studying the effects of neighborhood walkability on travel patterns and sustainability for 25 years, and his work is highly cited and referenced. Dr. Frank works directly with local, regional, and provincial or state and federal agencies to help translate research into practice-based tools that provide direct feedback on the health and environmental impacts of alternative transportation and land development proposals. We had a little chat just beforehand where he explained a little bit more of that. I'm very interested to follow up on that. His position at UBC is split between schools of community and regional planning in the Faculty of Applied Science and population and public health in the Faculty of Medicine. Welcome to Edmonton, Dr. Frank, and thank you for joining us. And finally, our moderator, Zanette Frost. Zanette is the program manager of the city's Hello, How Are You campaign. She leads a team of talented project managers that are working on key council initiatives such as gender-based violence, sexual assault prevention, and mental health urban isolation, as well as programs that further the city's social agenda. And she was recently in Mexico City for the United Nations Global Forum on Safe Cities and Public Spaces. We really appreciate her participation in tonight's session and facilitating. So I'd like to hand things over to Zanette, and I'd like to thank you all, and I look forward to a good evening of discussion.
Thank you, Peter. So we've spent, as a panel, we've spent about an hour together getting to know each other and sort of starting to pick each other's brains a little bit. So I'm going to start with, I want each of them to answer this question, and they did have a heads up, but I'd like you to tell us a story, a 6-word story, about what you think a healthy city is. Go ahead, Yvonne. We'll start with you.
Did I? Okay. Oh, I'm going to say I truly care about my neighbor.
Wonderful, thank you. Anne?
A caring, connected city of neighbors.
Beautiful. Candace?
All residents confidently meet their needs.
Beautiful. And Larry?
A diverse, connected, uplifting, inspirational, beautiful, and integrated place.
Beautiful. Well done.
I added a couple words. I cheated.
It's okay. I wasn't counting, but I thought of asking them to count. So we're here tonight to talk a little bit about urban form, our health and our well-being. And I want to start off with Candace on how you think we can build for better connections.
Better connections. I think it's important for us to think about connections in a lot of ways. We can connect to places physically by going from one place to another, by walking through a door, by choosing to sit and stay or to walk past. But I think we can also connect emotionally, spiritually, and socially. So you can feel part of something like the Orange Crush, even though we're sitting right here, right? My husband totally scolded me for coming to do this instead of that. But I think it's really important to think about connection in a 3 or 4 dimensional way when we're trying to build strong, vibrant, healthy cities. So we can think about creating transit that gets us from one place to another. We can think about creating accessible spaces to people with all kinds of, so that people of all kinds of mobility can connect with place. But I think it's hearkening back to Councillor McKean's words, it's also about creating a sense of connection with others in shared spaces. And whether that's a room like this one, or our neighborhood, or even strangers walking down a sidewalk in a city and saying hello, I think thinking about connection in its multiple ways is really critical.
Thank you. So I'm going to hand it over to you, Larry. So do you think this conversation about health and cities and urban form, is that something new? Or is it that we just haven't talked a lot about it? And maybe what do you think has changed that we're now really paying attention to what's happening?
Well, this conversation is new, but for a long time, I mean, zoning is predicated on health, safety, and welfare. We kind of knew about this a while ago. So how we build the tools that planners use, the legal tool, is actually underpinned. So what we learned, though, was that we built communities back in the 1920s, Separating different uses was the thing to do to promote health because of smokestacks and industry having, an adverse health effect, but we got too good at it. So we separated everything out, and now we realize that there's no connections. Exactly what Candace said, there's none of that happening. We need to move back together so that we actually get the benefits, and we no longer have those problems, industries being problematic in terms of health. So what's new is the need, and we now understand, even, go back even 15, 20 years ago, this was understood as well. So what we've learned in the last 15 to 20 years is that, yes, in fact, there's no doubt that we'd be healthier physically and mentally if we had more connections, and we need to have more connections. We need to be a little more compact. So what's new now is how do we apply this evidence to affect decision-making and overcome institutional barriers to doing that, because we're entrenched in building a car culture. Thank you.
Thank you. So, Yvonne, I'm wondering if you could help us understand a little bit about how beyond the built environment, how some of our non-medical influences are what we refer to as social determinants, like education, income, occupation, the social support networks can impact our health. And do these factors interact or overlap with our built form?
Yes, I do agree. Many of us in this room, how many of you are immigrants or children of immigrants? Yeah, many of us here. Hey? It's unfortunate that we don't have a lot of way to connect with each other. And we do have a dream. We dream that if in each neighborhood, you're all going to giggle of it, we're going to have public tea houses where you can come together, have a cup of tea, and food is a gateway to our souls, right? So we over tea, over something delicious, we get to know each other, and we melt away the socioeconomic and cultural distance between us. And we do need more of us, particularly those of us who can speak another language, to be the broker, to introduce people to each other and bridge the language. So it's within an intentional space that's beautiful, that's peaceful and safe, where we can come together over tea and get to hear each other's story.
Beautiful, thank you. So a lot of, I think a lot of people in the audience as well as here, we have all different levels of expertise and knowledge and lived experience. So I'm curious, Anne, how do you think that might impact the work that we do in building connections and how we engage with others about our health? And I'm thinking health in the most global form, our mental health, our physical health, and perhaps what are we doing, what are we maybe missing in engaging those hard to reach groups?
Yeah, I think one of the keys is to bring it down to a scale that's manageable. So when we think about these big picture issues, and we think about social isolation, mental health, that's daunting. If we, even in a city of Edmonton, not one of the biggest cities in the world, it's not small enough scale. So if we can bring that down further to a manageable size, it becomes less daunting. So if we think about a neighborhood like a village where people can take care of each other and get connected and get to know each other, then it starts to become something that we can maybe start to address in a more meaningful way. And neighbors can be like health brokers for each other. They get to know each other, they learn what they have to offer, what they're good at, and through that, inherently, they will come to know the needs too, and the health issues and economic issues and any type of challenge we might face. That's not going to happen unless we build relationships. And we all know that relationships, a solid relationship helps us in everything that we do. So with the City of Edmonton, there are a number of initiatives that are really looking at the local as the way to address these big picture issues. And how can we encourage each other to take responsibility for these things and share in that. So citizen-led, local is, I think, the way to get at these big picture problems.
Beautiful, thank you. Do any of the other panelists have anything to add? They're speechless. Well done, Anne. So in the work that many of us do in the area of health, we often think of that work sometimes along a spectrum of prevention, harm reduction, or intervention. and I'll open it to all the panelists, how do you think urban or built form fits into that spectrum of prevention, harm reduction, or intervention? Go, Larry.
I think there's a growing understanding of the built environment as an enabler or disabler of being active or sedentary, of being connected or disconnected. People have predisposition, attitudinal, we come to the neighborhoods we live in with preferences. But we don't all live in our ideal environment. So regardless of where we live, if you live next door to someone who likes to walk more, that person's gonna walk more. But if you both move to a more walkable neighborhood, you're both gonna walk more. So there's a way to think about that both your attitude and who you are, and the environment where you live will enable or disable that preference. And what we're doing at this point is we're under-supplying the kinds of environments that actually a lot of people want. We have tremendous amount of evidence showing the price point, the dollars per square foot of walkability has gone through the roof. There's a reason for that. So by undersupplying the environments that would enable and support people to manifest what is actually good behavior is a form of, well, it's crazy. That's what we're doing. Thank you.
Anyone else have anything to add?
I think our built environment really, to build on what Larry has already said, our built environment gives us an opportunity to think about how well we want to align the things that we build around us in where we take place our daily lives, and the services and programs and things we do in our daily lives. So we can build fantastic recreation facilities, we can build beautiful public spaces like this one, but then we need to think about, well, is there space for cars? Because our society is dominated by cars, but is there space for transit? Does transit run on regular hours? Can people afford transit? Can they bring their kids on transit? Does transit get to the rec center at the time that programs are offered when there's childcare available? Do the people who are new to our community have the right shoes to take part in our recreation facilities? I think this is just one very narrow kind of example to talk about how our built form creates sets of explicit or obvious and subtle expectations of what it takes to participate in a community. And I think it also creates an opportunity for all of us to say, well, if we want everyone to participate, how can we create the conditions of that participation? And it's a chance for us to sort of big A, advocate for those kinds of changes at a policy or planning level, but also small a, advocate for those kind of changes in our homes, our workplaces, and in our public spaces from a neighbor to neighbor level. And so I really think that my key message in response to Zanette's question is that making built form a way to connect is everybody's job. It's not just built environment experts' job or planners' job or public health's job. It's all of our job.
Thank you. So, Yvonne, why are you excited about the work you do, and how do you think it contributes to a healthy city?
Yeah, I wouldn't use the word excited. I'm grateful to be working with colleagues who are part of the immigrant refugee population. And I really wanted everyone to recognize there's deep poverty among many of the families who are from other countries. And so I'm really hoping in venues and places like this, we mustn't forget there are many families who are struggling every day with housing and food security. So I'm really grateful to be here because at least there are 100 of us in this room. If we just stop forgetting others who are invisible at this moment, we would have a better city.
So you sort of touched a little bit on the vulnerabilities and on vulnerable populations. So a question to anyone else on the panel as well: how do we engage those vulnerable populations in a way that is meaningful and makes them feel more connected?
think it comes back to the neighborhood again. We all need to share that responsibility, like Candace said. We need to get rid of that not in my backyard mentality. If we, in an ideal city, each neighborhood took care of their homeless, their mentally ill, those who had mobility issues, any challenge that we might face, then we'd be in much better shape. So if we share the responsibility, each of us as citizens of Edmonton, and do our part on our block, then we start to see a change. And we can't put it all on the institutions and the systems or a municipality or any organization for that matter. We have to work together. So I think it comes down to enabling each other to use the gifts and the skills and abilities that we have, and helping each other to access the services as needed, and taking care of our own.
Thank you. Anyone else?
Sure. I think there's social media is now something that can work against us in terms of there's different kinds of social capital, bonding. Oh, never mind. but the
bridging and bonding.
Bridging and bonding. I was going to use those terms. Yes. So that's what was in the book Bowling Alone when first written. So I think they're reaching out using leaders in communities as a way to connect with the members of the communities, as a way that we've tried to work in the past. So as opposed to going directly to community members that are the hardest to reach, work within there are so and also instilling and supporting those social structures so they exist in the first place, and then using the members that are trusted as leaders of those communities is really a very helpful, this is, a strategy. But I was also going to say that there are ways that we can now communicate information more simply and visually, and I think that's a tool that we need to use better so people can visualize their community changed with different, and they might resist otherwise, but if we empower them to visualize and embrace and use these tools so that it's their idea, empowerment to change their community in ways that might really help them. That's what I was.
Thank you. So I'm going to open this up again to anyone in the panel who's willing to take this one on. When you think of the influence that the built environment has on our health, what is one of the areas that the city or cities that you've been familiar with is doing right or have going for it? But then I'm going to add a little bit after I hear what you have to say about some other features that are specific to Edmonton.
You have some ambitious and I think funded transit plans. And I think that's the backbone. That's the spine, and building the communities around that are emerging around transit is really going to be very helpful. And you also have the scale of redevelopment happening in a few locations. The airport, the old city airport site is a really wonderful opportunity. So I think that's one area. I think the focus around mental health and sense of community as a higher goal, which we're here talking about now, is correct. You can have physical health, but without mental health and well-being, it's really not meaningful as much, or nearly so. So I think you have a lot of momentum in these areas, and I'll turn it over to others here who know more than me about this.
So I think the other thing about when we think about redevelopment and density and all kinds of things that grow a city, we also have to think about not just the intended effects, but the unintended consequences of some of the most vulnerable members of our community. And so I think change inevitably creates more change, and that change is felt the most strongly among people with the fewest resources, as I think was said earlier. And so I think one of the things that is really incumbent on community looking at doing things right, the way that many of our communities do, about growing and thinking about growth in a sustainable, equitable way, is to think long-term about the shifts and impacts that are felt by those with the fewest resources, and how do we attend to those kinds of equities. So, you know, when we're building transit, when we're building high density, what does that mean for newcomers or people with small families and limited resources, and how do they fit into that mix?
And I'm actually very proud of our city for creating multicultural centers. Have you been to Clairview Multicultural Center, or have you been to Macaulay School? That's an Edmonton Intercultural Center. So spaces are being created, like Edmonton Intercultural Center is in Macaulay School. So an old school is being repurposed for the reason of us coming together. That's something really worthy of celebration.
So, although you would not believe it, it is spring outside, but we are a winter city. And so what do you think are some of the ways as a winter city we can perhaps enhance or improve perhaps some of our built form to improve connectivity, to improve our health and well-being?
I think of Danny Hoyt, who's sitting right here, actually. We need to use what we have in different ways. He started these hot chocolate socials in Oliver in Kitchener Park. Anyone here from Oliver by any chance? A few? Woo, me too, Oliver. So Danny Hoyt, he was living at the time in Oliver. He's now in Riverdale. And he started up these, every 2 weeks, was it? Hot chocolate, bring your own cup. He had cups just in case you didn't bring yours. Tea, and they would have a fire and sit around the fire and have social time. All through the seasons, all weather, they went for it. They were there. They worked with city staff to get their fire permits in place. Don't worry, everyone who is a city worker here. It's all good. It was all legit. And I think they got a few complaints at first. I think some people called the police and said, what's going on out there in the park? There's a fire and there's people and oh my goodness. So just, you know, challenging that too and saying, let's get out in our shared spaces and doesn't matter what the weather is, we can gather and embrace it and just dress warm and bring your cup. Good job, Danny.
Thank you. Anyone else?
Sure. I grew up in Rochester, New York, which has a lot of snow because Lake Ontario, the air comes from Canada across, dumps so much snow. So earlier we were talking about the walls of snow. Do you want to talk about that? No, I think okay. So
I was telling tales out of school.
Well, it's on the way snow gets removed. I mean, there's some things about in Vancouver this year. We actually had snow was on the ground most of the winter. I don't know if you're aware of that, but you're not alone. And it was like, you know, neighbors, we'd look at each other like, well, they didn't shovel their sidewalk, so there's no sidewalk over there. So I think there's, you know, awareness raising and working together where you have other people in the community that can't shovel the sidewalk, working together so that we have pathways, just that connectivity again, but in the winter. Simple things like that, but working together and being cognizant of the importance of connectivity. But I think this also comes down to maybe definition of public realm. Public, you know, I was thinking about this before, we tend to have a division where public space is usually outdoor, private space is indoors. But if outdoors is very, you know, less inhabitable, shall we say, in the winter, although if you have a bonfire, it does help, but we can't walk around with a bonfire. So if we have to find a way, we really need to find a way to have public space indoors. You need more indoor, and it sounds stupid and simple, but I was thinking the design configurations where there's the ability for people to connect by choice to public realm in their community that is interior space somehow. And there's designers can figure this out. We have similar problems. You can think about air pollution exposure where we know that walkable places are actually more air polluted. It's a problem for us. Particulates are higher in concentrate. We know this. People moved away from cities long ago. Now we can measure it. So by the same token, we need to learn through design to retain the benefits of walkability without the air pollution exposure problems, and that again can be addressed through design.
Thank you. Candace?
So I think I want to combine this with your previous question about successes. I think one of the great successes of our city, of the City of Edmonton, is we celebrate our status as a winter city, and we find ways to make that visible and to encourage everybody from all walks of life to take part in our winter city. And I think that that is something that the more visible we can make that through citywide celebration, but also through everyday practice, will help us adapt to our winter built form. Like, I think there's only so much, retrofitting you can do to a built environment and in a short period of time. But while that is happening, we can also, as a society, as a civil organization, make being connected in our city in wintertime visible.
Thank you. Yvonne?
Yeah, maybe Anne and I will say, whether it's outdoor space or indoor space, we need winter facilitators, brokers, really encourage people to come together, encourage people to enjoy activities, whether it's outdoor and indoors. We need the people connection. Yeah.
Thank you. So I'm going to open it up to the audience, and I'm wondering if there's any burning questions from the crowd. Okay, don't all jump at once. Yes.
Thank you very much for the panel. So you talk a lot about that, promoting health, especially in our communities, in our neighborhoods, is a shared responsibility where individuals really connect with one another. But I guess I want to bring it back to the policy level, and I think there's a lot institutions can do to create the environment so that people are more likely to talk to one another. So if it's open to anybody, can you talk a little bit about how can we bring that health lens into the policy development process?
Great question. Anyone on the panel? Yvonne?
Karen, ideally, when we do have a chance to come together, particularly with those who are most marginalized, we actually create an opportunity to hear from them what brought them into poverty, what kept them in poverty, and what we learn we should share with our colleagues within government, and of course with municipal government, the government closest to the people. And from there, hopefully we channel the knowledge towards other levels of government. So it's a form of, we can come together and make it an active form of citizenry. I think that will make a big difference.
Anyone else on the how do we get this to policy?
So I'm going to probably say something a little unpopular, and forgive me, no F-bombs, I promise. So I think oftentimes we know when we're making policy, one of the most critical factors that's considered is economic return on investment. When you make an investment, you want to know that there's a return on that investment, and that return can take a lot of forms. And I think one of the critical things that we have an opportunity to include in policy making is an assessment of a health return. And that is sometimes at odds with an economic return. And I think one of the things that, one relatively straightforward thing that can be done around any kind of policy decision that's being made is to include a health impact assessment as well as a sustainability impact assessment along with policy development to think about in the context of relative to, return on investment economically. It's a different kind of return on a capital investment, one that has, I think, speaks to prevention, which was a theme that Zanette brought up earlier, but one that has a much more longer sustainable return, but it may outlive a current decision-making cycle. And it's food for thought, right?
Yeah, that social return on investment is being considered more and more in the work that this municipality is doing, that our provincial government is doing, our organizations, considering the stories and how do we build the social capital is I think definitely on the agenda. As a city employee, I'm hearing that encouragingly more and more. And with the work of the public engagement initiative as well, there are a lot of new methods and processes beginning to be rolled out that will help enable each of us as citizens to have more of a voice and contribute to the knowledge that's needed to measure that social return on investment.
Right. And Larry, you had something else to add as well?
Yeah, I completely agree with what you both said. However, we've actually been monetizing the healthcare cost savings of investing in active transportation and in the workforce productivity. There's actually, the economic argument is embedded in the health benefits itself. So if you monetize the health benefits, you actually find that the investments that are needed pay for themselves through reduction in healthcare cost alone. We've just finished a study in Los Angeles, got about $2.45 payback for every dollar invested in active transportation infrastructure as they build out their system. There's an additional $6 back on workforce productivity, and the fact that building sidewalks and bikeways is labor intensive, less bricks and mortar than building roads. There's dollars that ricochet in the economy, so you actually have the answers right in front of us in terms of the economic payoff from the certain investments. Transit, non-motorized, pay back. It's just, and what it is the same tools that have been used to justify building roads through congestion and delay, all that money that we lose through congestion because you're sitting in your car, that delay is loss of productivity, and the same tools that are used by regional governments, actually, if you turn it the other way, shows a huge payback if you don't build the roads, but you build transit and non-motorized infrastructure. So it's kind of a new way of thinking, but I think that it's starting to make some sense. And there is a time frame, though. It doesn't pay back immediately, but pretty quickly. And so Vancouver just built a bikeway downtown, Comox Corridor. It was about $6 million bucks. But we showed right away the physical activity benefits and the reduction likely that we know comes from chronic disease reduction. That's a fairly modest investment. Came back, would pay for itself, and they're using that to build new greenways. So.
I'm pretty sure there's some planners in the room that are going, ooh, we're going to talk some more tomorrow. There was another question, I believe, over here somewhere. I think the gentleman at the back, and then you. Ma'am.
Thank you very much. This is a question of more of the policies, the procedures, and the mandates and the efficiency. Every time we talk about this word like healthcare, the immediate, reflection we have about it, we think of the hospitals, the doctors, the nurses, the medical centers, things like that. But we all know that actually it's much more broadened. Every time, we talk about the mental health or illness, or we think of the physical, illness, we know that how beautifully, but also unfortunately, reciprocally, they are so interrelated to one another. What happens though, what we have as a healthcare, to what I have been understanding around the world, Edmonton is no exception to that, is more of the sick care. We don't really truly have known something as a healthcare, because my question then in focus is that how we can shift these paradigms of the healthcare that is being understood in context and process in a wrong way to another paradigm, which is rather than focusing on the treatment and the cure, on the prevention. That's where I think we're going wrong. If the time allows, I can give you an example what is really happening in Edmonton that I don't know. Am I allowed to talk more, or should I just stop there?
We'll let the panel answer your question about changing policy from being reactive to essentially being proactive.
I completely agree. We need to look at the root cause, and there is so much that we can prevent. Then we wouldn't even get to the point where we need these extreme and complex systems. Of course, there's always a time if you need to have heart surgery, you really want a surgeon who has been trained and can do that for you. But there are so many ways that we can shift the way that we access our systems if we are preventative and proactive and look at the root cause. And we can only look at that through getting to know each other. And I mean, there's lots of research to look at it. This isn't something that's new. We all know it. We've probably seen it in pieces we've read. We can learn from what's happening here and in other cities. And there's a study in Arizona, and it's already 9 years old, and shows the connection between people saying that they feel connected and know their neighbors are cared for and care for their neighbors. They correlate this with greater health and wellness. So we need to get at that root cause. We need to think about that when we're making these policies, and we need to be preventative. I agree.
Great. Larry?
Sure. Built environment is preventive medicine, for sure. We know that. It's the institutional disconnect. And to the degree which it's the same here in Alberta as it is in British Columbia, I'm not sure. But we need a social experiment, which is to institutionally connect the ministries of health, the Ministry of Transportation, and others, vertically as well with municipalities, and test it and see if we could, their dollars that are saved, that's the frustration, as the mayors and councilors know, we're going to spend all this money on active transportation, the payoff, it's the wrong pocket, it's the pocket issue, who's, color, whatever you want to call it. But so that institutional disconnect could be solved with forward thinking, at least on a pilot. It could be tested, and if it works, that would be the future.
Thank you, Yvonne, and then I think Candace has some.
Just a brief comment. There's been so much research done on the social determinants. Only 15% of our health is impacted by having access to health care. The rest is tied to income support, social connection, freedom from racism.
Thank you. Candace?
Yeah, and I was going to say something similar to Yvonne. You make a point that's well known among health promotion researchers who have been fighting for 30 years to have a shift in the proportion of dollars that are allocated to health care to prevention. And I'm sure many of you know that that proportion looks something like 97% health care, right? And that's a really hard number to shift because the payoffs in prevention come a long way off and the demands for healthcare utilization are right now. And the trade-offs in terms of the political trade-offs in terms of reallocating dollars that would have gone to healthcare to something like income adjustment or poverty relief is not often palatable at voting time. And that's it seems like an inconsequential way of describing that, but it is, I think, one of the most challenging barriers that those of us who advocate for prevention have to face, is that there's a disconnect between the institutions where the problem occurs, where the problem solves, and where sort of the will to invest flows.
Thank you. There was another question, I believe, from the lady in red.
I believe on everything about prevention. I'll just give you a little example of something that happened. I was involved with the warming center. The city was very interested when it was very cold and the people had a place to stay until they got their beds. What they didn't realize is that after several months, they formed a little community. And they said, how come your numbers are the same? My gosh, and some of them are increased. The thing was that all of a sudden these people became friends. They connected with trying to get jobs for each other and help them out. So we think too much in black and white, and that's the problem. I'm in prevention and I work with young kids. We can't get the results, If the kid's 8, we have to wait till they're 18 to see the results, But it's much, 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 much cheaper. And that's what you got to give the people to say, this is cheaper. Because I think what's happened is we've got it on the prevention, and then we have to do it on the other side because we've screwed up so badly on the other side.
Thank you. Elizabeth, did you want something, Councillor McKean, to say something? You want to answer a question? Ask a question. Okay, the lady over here had her hand up first, so I'm sorry. I might not get a pay raise.
Hi, I actually have a question to follow up with what Candace was saying. So how do we get voters to value health promotion, social return on investment, and all that fun stuff?
Can you ask Larry that question? Because it's super hard. No, I'm
yeah,
kidding.
No, anyone on the panel.
Well played.
I think that's a question we're all grappling with, because I think ideologically we all buy into prevention, every single one of us, until I think we feel like it's hitting our pocketbooks, until we feel like maybe it's jobs on the line, until we feel like maybe there's trade-offs we'd rather make, right? Like, prevention is the most real when it hits home. When it's your kid going hungry to school, that's when prevention matters, right? It's less real when it's some other neighborhood somewhere else, right? So I think making these things palatable for voters is really about tying it to metrics that matter and metrics that they can understand. So, and I don't want to dismiss the intelligence of voters, because voters are super smart, right? We're all super smart, really. Maybe me less so, because I'm sitting up here saying this. But I think what we really need to do is really create a chain of logic between why invest in prevention, what that means for us right now, what risks and trade-offs, honestly, that we're assuming right now in favor of that for a longer-term benefit, and to really, for our brave politicians, because really they are the ones who have to fight the good fight in the halls of policy, to give them the ammunition they need to make these arguments and know that they have constituency support behind them for the long haul, right? Not just when times are good. Because sometimes prevention is expensive. It comes at the cost of other things in the here and now. And we can't ask for prevention on one hand and complain about not receiving other services on the other hand. It's a dollar can only be cut so many ways. And so I think it's about all of us, and I say us thinking about scientists and practitioners, to create meaningful evidence and metrics that can be used by voters when they're making decisions, and used by policymakers and decision makers when they're basically creating our social built form. Because policy is what creates society, and then the built form follows, right? So I hope that answers your question a little bit, but now I'm going to look desperately to my co-panelists to fill in the blanks.
And Larry's jumping at the bit.
I will take your challenge. But I'm glad you went first. There is money being spent all the time. We're building new infrastructure all over the place. We're spending a fortune all over the world. We are externalizing the health impacts, the adverse health impacts from the calculation of what to build and where to build it, and we're externalizing the environmental impacts as well. When you start to measure those impacts, you come up with co-benefits, multiple wins that come from certain actions in certain places. Money can be leveraged, even though on the health sector, pretty hard to take dollars away from treating conditions that exist. There may be a little bit of money, even if it's 97%, 3% still probably a lot of money, believe it or not. That can be leveraged against transportation funding and other money. So there is at least a little bit of money that can be used as start to do some things, develop some wins, demonstrate that, communicate it to people what happened in this neighborhood, preferably a neighborhood that's at risk, where populations are more vulnerable, to show that saves a tremendous amount of money for society and improves the benefits of those most in need. But I think it's going to take a conversation horizontal thinking across disciplines to deal with this issue, because we've got certain sectors of the economy are building stuff affecting the health of other sectors, and that it needs to be connected.
Anyone else?
I think in addition to all of that, the next wave of energy and change needs to come from citizen-led initiatives. And I think there's a man named Cormac Russell who said, "The best welfare states are an extension of us, where we are not too dependent on the services." And so some prevention is not costly. If we think about, it sounds just ridiculously simple, but getting to know each other has health benefits where you live, and that doesn't cost anything. So there is some prevention that we can do that doesn't cost any dollars.
And it'll be as simple as saying, hello, how are you? Councillor McKean.
Thank you. Larry, I want to ask you this. We heard during a public hearing we had this week on a tower project, one citizen brought forward the idea that there are studies to show that towers can affect mental health. So it's I've wondered about this before, and I don't know if any municipalities actually have this, would be a planning psychologist or a planning sociologist. And in a broader sense, what we're talking about here tonight, if municipalities would be wise to be hiring public health doctors or public health practitioners, then that could give their best advice to city councils on these sorts of matters. Because we have some really talented people working for the City of Edmonton, and a number of them are in the room tonight, and I would say that even if they weren't here. But I think we're maybe missing, so that would at least generate some discussion in council and in council committees, and would be interviewed by the media, and it might be a way to bring more focus to these issues. Anyone, but any thoughts on that?
Resistance to densification is always, you know, a big challenge for us, and there's going to be arguments leveraged all the time. But there are public realm and spaces that can be created from the development. That's, you know, obviously that's one of the things that creative developers are doing to compete against each other, is to have, you know, public space in buildings that are places for people to gather, whether it's a rooftop or at the ground level or wherever. You know, obviously is one strategy, but there is definitely the ability to show citizens, as you're bringing forward proposals that are resisting, all the health benefits that come to them directly, to their neighborhood. And maybe part of the mitigation from the developer is to identify the things that they want the most and try to, you know, that have health benefits and measurable outcomes and performance for them, and actually have that informed by evidence.
Yeah, and you were, last one, I'll stop. You were talking about about monetizing health benefits. So if we'd had the information before us as a city council that the $13 million we were about to invest in cycle tracks on the north side and south side would be equal to this much in health benefits, and we had expert advice giving us that would open up a whole new area of discussion. But we didn't have that. Not blaming anybody. We don't do that normally. So I thought that's a really interesting idea.
It's still fairly new that we've been able to make that connection, but it is substantiated, it's logical, it's, when you look at it, it's almost a bit of a no-brainer, but you have to measure it and pencil it out.
And the province would give that amount of money to the municipality right away, I'm sure. Every dollar saved.
Immediately.
Yeah.
We can't stop them in British Columbia from giving money to the municipalities. It's very difficult to keep that money from flowing, stopping that money from flowing. During the election, I think it's like this week.
I believe this gentleman in the third row.
I think Councillor McKean asked a similar question. We've got an example of a potential case study of a large 80-story building development at the edge of a marginalized community that's slated for redevelopment. And the little that I've heard about it, the developers talking about the economic impact, we're talking about all of the, it'd be very interesting to see what could be done to talk about the health benefits and risks of that development. I'm not sure if there's time to do that, have that conversation, because that's before council now. But I would be interested to know what alternatives there are to bring in a conversation to that talks about access to the River Valley, walkability, all of those things, in addition to the economic impact of this particular development. I think it's a great case study. There's a master's degree or PhD thesis in there at some point, I think.
Anne, did you hear that?
That could be great for my project. We will chat.
Anyone else? Any answers? Any suggestions from the panel? Like Candace?
I think it's a delicate situation, for certain. And I think nobody would argue against the correlation between densification, sustainability, growth, and healthy cities. I think, though, that there can be very strategic decisions about when and where exactly densification happens, to make sure that the positive health and social impacts of densification are felt more equitably across all margins of a community, as well as the detrimental impacts. And so I think you raise a very interesting point around, you know, doing a case study, understanding. I think a lot of that knowledge is there. Maybe not for this particular initiative, but I think there's a lot known about the impacts of densification and the locations of densification relative to other kinds of community infrastructure that could be drawn on, both from a health place, an economic place, and a sort of social community development place that might be beneficial.
Thank you. We have time for two more questions, and I believe...
I just had a quick,
Sorry.
It is possible, though, to make a fairly simple experiment and demonstrate that the number of people that are going to be located in the 80-story structure in that location, given all the amenities around it, compared to those same people who otherwise could be located in sprawling environments where they spend a lot of time in cars, where obesity is going to be higher, the rate of chronic disease, diabetes, cardiovascular risk percentage higher, using some pretty reasonable numbers. You could show that and monetize and just make the case comparatively. If that type of development is not allowed to happen in places that are people are most protected from a health perspective, and then address the mitigation to the adjacent community through money that could be generated from the development, it's not impossible to do that.
Okay. Marco, you're...
Can you hear me? Hey, my question, I know you, it's all about prevention, and I hear about Larry about public place for people like homeless especially. That was really, really needed in the city, because I'm involved in Learning Center and also Salvation Army and all different, I'm attending all that. I'm seeing like after 11 o'clock, people are peeing or shit all over the place. There's no washroom, public washroom. They close them at 11 o'clock. That's very, very needed. And also, I know you guys are panelists and advocate for prevention. And you mentioned about connection. To be able to know that, to monitor it, my question is, do you really like go like a robot to see robots like seeing what's going on? And do you think that, I mean, this is what's needed? And then of course, money, it's important, money is always number one issue. We know healthcare is the biggest, and $1 billion almost a year in Alberta alone, just for healthcare. And we do know like it doesn't come up right away. And of course, if we have a plan and action, and like I said, we worry about environment, without action, without looking at the problem, and also management, who's really doing the action and giving the money, and the money that giving is a monitor, I think that problem could be solved. I know it's not going to happen overnight, but I'm seeing a lot of problems. So if you guys can, any one of you. Thank you.
Any takers?
Are you asking who needs to take the action and how much, you know, who's going to pay for this, or?
I'm listening for you guys, what you're talking about. Mm-hmm. That's prevention. When you say prevention, okay, where is that going to come out? How do you address that? Who do you deliver it? Who's taking over it? So like I said, we can't just keep saying it over and over, because I attend so many of these in university and here, and the problem is still the same.
So who's responsible for the prevention?
How you guys deliver? Who's going to do that? That's what my question, because problem is still a mess, still not changing it. But there's a lot of pushing pencil that don't see the problem, but I see the problem myself. So there is a problem, it's not pigs, but a lot of talking. That means it's action should be done.
Yeah. So, Candace?
So prevention is in a lot of ways invisible. And so I want to use an obvious example that probably all of us have exposure to. and talk about smoke-free spaces. So smoke-free spaces is a social intervention on built form. It changes the way that we use and experience the spaces that we're in by not allowing smoking in certain areas, right? That is one aspect of a multi-pronged tobacco prevention initiative that over the span of 30 years, so the very first smoke-free spaces bylaw came out now about 40 years ago. And it was about, okay, I'm doing mental math, it was less than 20 years ago when it became a popular gold standard best practice for municipalities across Canada to take up. And in the last 20 years, smoking rates have gone from about 30% to about 17%, with the biggest gains achieved among teenagers and younger adults. This is a really critical prevention win. Now, I get that we're not talking about tobacco control here today, but what we are talking about preventing the health ills that come from improper thinking about built form, we're at the beginning of that cycle in a lot of ways. We're at where we will see the gains from this in decades to come. And so the prevention efforts, what we are here now is you're seeing the invisible prevention efforts that are going to realize substantial, obvious, explicit gains in 20 or 30 years. I don't feel satisfied with the response I just gave you, but that's the delay of time around prevention. Now, I think Larry I'm going to pick on Larry and also Anne because they're sitting right beside me. I think there's some really obvious examples of quick wins, right? Safe injection sites is another kind of social intervention that sees immediate successes around preventing harms on society. That's a controversial topic to talk about, but it has a much more time-sensitive prevention gains. And so I think another one is bikeable communities, right? You see very quickly a rapid uptake of people who are able to get from one place to another. This is not speaking to homelessness or the kinds of issues that you raised in your example. Those are much more, I think, complex problems that require very careful and strategic policy decisions at municipal and provincial levels to resolve in a satisfactory long-term way. But I do want to leave you with the message that prevention investments do pay off, and we do actually see measurable shifts in health outcomes over time.
Okay. Larry or Anne?
Sure, I'll make a quick comment. Building infrastructure, physical changes to built environment is time-consuming. It doesn't happen overnight. In certain places where you're building your transit stations and so forth, it'll happen pretty quickly. For people who live there, changes will be significant. And there's an affordability component. We haven't been talking enough about the housing affordability piece that's critical. I'll put that aside for a moment. What can be done quickly are programmatic or policy shifts. Insurance, car insurance is like a buffet. You pay one price, you can drive all you want. There's been a lot of discussion over the years of why not pay as you drive. If you don't drive, you don't need to pay for insurance because you can't cause an accident if you don't drive. So that makes sense. That would be a way to turn the cost of insurance from a sunk cost into a marginal cost. And you walk out the door of your house, if you have a car, you may say, you know, if I don't drive right now and I walk, I won't even have to pay insurance this month. So that is an example of something that can happen quick. I'm just trying to, think those are the things, and that can be quite politically, if it's, done in the place, could be quite successful. It could actually be a win. Look at what they did. Wow. Measure it.
And do you have anything to add? And then we'll go on to the last question.
Yeah, I think there's a sense of dissatisfaction and restlessness with that too. So we can do all of these things, and those of us who are in positions to make change to policy, we should be doing that with all of the energy that we have. And in addition, as citizens, we need to be doing something else at the same time, because I think there's a growing recognition that the institutions, the systems are a bit too big to get down to the nitty-gritty. And so one of the things that we can do with our organization hat on is to enable people to be more involved in this action day to day. And I mean, there's government policies and social services are at their limit in many ways. The next wave of impact has to come from each of us as people who live in Edmonton.
Great, thank you. All right, our last question from the crowd.
Hi. First of all, thank you for having this. So I know there's been studies in the past where they put buildings and there was narrow windows and narrow hallways, and they had a lot of problems. The way people socialized, there was an increase in crime, and it was demolished in 5 or 10 years. And I think this was in the 70s or 80s. And we know that I'm not sure if Edmonton has this initiative, but I know that the city of Lethbridge in certain neighborhoods, they've promoted putting porches in the neighborhood. But it's not always feasible to have a built environment totally change because of some policy, because people can only afford so much. And you mentioned earlier that you wanted a lot of grassroots, and it was just been reiterated again, and that people were isolated. I know that one of the school systems in the city of Edmonton promotes students to have a number of volunteer hours working in the community, which could help prevent some of this. I know that the UK has a charity that's looking to promote getting seniors away from isolation by promoting people to visit and make relationships through charities to go visiting people, whether it's would be in a center or going to the local tea shop. We also in the city have community leagues, and these buildings, some of them are utilized quite a bit, but some of them sit there. And we could have something like teas or sports or competitions or something to get people more involved. I just was wondering if you guys had any other examples of that, or how we should be promoting more of those things.
So how should we be promoting more connections in our communities?
Can I answer that?
I would be surprised if you didn't want to answer that one.
There are a number of people in this room actually who are beginning to identify as block connectors. They are people who initiate conversation, relationship building, getting to know your neighbors, really simply just getting to know your neighbors. They might be that point person on the block in case of an emergency. They might help put together a contact list. They might organize a block party or a social. That's really what it boils down to. That's what they're doing. And they're working in partnership with community leagues. And we're seeing amazing things happening from these Edmontonians who are identifying as connectors. And many of you would likely identify as such. You can call it whatever you want. You might be someone who in your own condo building or apartment or house, you are the person who knows everyone and you connect and you liaise within your community. This is something that is not new at all. This is something that we see all throughout human history. And this is happening in Edmonton and a number of other cities. And I think it's an initiative to be proud of. It's one that the City of Edmonton is supporting, and Edmonton Federation of Community Leagues, they work with community leagues across Edmonton, is also partnering with this initiative. And it's very grassroots, and it's just basically a reminder of the importance of knowing the people who live around you. And hopefully this comes naturally to us, on a day-to-day in our life, but when it doesn't, maybe a little friendly nudge is helpful. So building awareness of the importance of that.
Great, thank you. So I have one last question for each of you, and then we'll wrap it up and we'll have some time to meet new people and ask more questions of the panelists on a one-to-one basis. So what are some of your final thoughts on, or lessons on how each of us can, should, or cities support, contribute, and promote to achieve that healthy equity?
Maybe I will promote End Poverty, Edmonton here. Every single one of us, we are probably one relationship or two away from a family whose children are not having enough to eat. So the issue of poverty affects all of us. So I'm just inviting all of us to be health equity promoter, and by seeking out those whose presence need to be made more visible.
Thank you. Anne?
Being a listener and acknowledging that each person we come into contact with, who knows what they're going through that day and that week and that year, and building a relationship wherever we can with the people that we come into contact with and the people who live around us.
Great. Thank you. Candace?
I think it's also really important to know that you don't need a microphone to have a voice. Each and every one of us has a voice, and whether that's with your fellow neighbors, with your block leaders, in your workplace, with your council member, writing a letter to your newspaper or your school, that it's important to use your voice to talk about how to make your physical environments and your social environments better for everyone in those environments.
Thank you, Candace. Larry?
I think learning to be better listeners, I think that's something that I know is important. We often have the answers without understanding the ears we're talking to. So I think maybe that's something I'm working on, and I hope that, I think that's just something where, as a skill, it's a real skill. And in order to be able to communicate, we have to first listen.
Thank you. So I want to thank our panel very much for their wisdom. When we had our dinner meeting, we talked a little bit about that notion of collective wisdom, and they kind of asked me what I was hoping to get out of this evening's event. And I think that there's a real opportunity here, and there's wisdom within the room, so there were some gems and some good questions that made me stop and ponder and think, and I think it will really help to kind of give some new direction and some opportunities for us to explore under the umbrella of the Urban Isolation Mental Health Initiative. So I want to thank everyone for participating, actively listening, and being involved in this evening's event. And thank you very much to our panel. I really appreciate the wisdom that you've provided and intelligence this evening as well. So thank you, everyone.